Good afternoon, everyone. I'm here today with Dr. Paul Kamitsuka, one of the infectious disease experts at Wilmington Health. Dr. Kamitsuka, I really appreciate your time today. Thank you for all you're doing. Thank you for your staff. Truly, they're the heroes on the front lines of this. We appreciate you taking a few minutes and sharing your expertise. I just have a few questions. The first question that I'd like to ask is, are we seeing any patterns in COVID in the local community?
So fortunately, here in Wilmington, so far the exposure to COVID-19 has been thankfully minimal. I think this is in large measure likely due to the fact that social distancing was implemented early enough before we had a large number of cases within the community. And with continued social distancing, we've been able to keep COVID-19 down at a low level. Today, for the first time, for example, at the hospital, there were no patients in the ICU with COVID-19. And that's the first time this has happened in the past several weeks.
That's tremendous. Do you predict any type of surge in COVID at this point?
So we are looking at a variety of different models, and the models are really all over the map depending on what assumptions are incorporated into them. The University of Washington model for North Carolina, for example, predicted that our peak, the surge, would be last Friday. On the other hand, other models predict the peak in July. The models that we've been paying attention to most closely have tended to indicate a peak sometime in early to mid-May. Now, one thing to really emphasize is that a surge or a peak does not have to happen. If all of us strictly attend to social distancing guidelines, so by that meaning keeping 6 feet apart from each other, when we leave our house to wear a mask, to perform hand hygiene on a regular basis, and also to disinfect high-touch surfaces, if we all do that, then a surge does not have to happen. I think the primary potential threats that face us right now are really threefold. One would be outbreaks in nursing facilities, second, outbreaks in prisons, and there are outbreaks in both of those kinds of facilities that are ongoing currently. And thirdly would be premature relaxation of social distancing. Any premature discontinuation, such as having an event where there's a crowd without social distancing, places us at risk for a flare of cases that could become dominant within the community.
When do you think it's appropriate for social distancing to be relaxed? How will we know?
Well, it depends on what you mean by social distancing. I think the kinds of measures that I just talked about are here to stay. This is not going away. Until we have a vaccine where we can vaccinate the population, until we have lab tests to tell us that the majority of the population has already been infected, the social distancing really needs to continue. There was a study published out of Harvard a week or so ago indicating the likely need to continue this through 2022. Now, that does not mean that we can't gradually open things up for business, and we are currently looking very closely at how we might be able to do that safely. The prerequisite for that really is twofold. One is ready access to rapid testing, and things have improved significantly in this community in that regard over the past month. But we still are limited in terms of the number of tests, particularly the rapid turnaround tests that we have, although we anticipate that will improve fairly soon. The other issue is, as you move from a mitigation phase, which we are in currently, where we're really trying to limit the number of cases so we don't overwhelm the healthcare system, to more of a containment phase, where we are able to test people broadly and have enough of a public health infrastructure to be able to identify cases, identify contacts, and make sure that everybody is appropriately isolated. We want to move to that phase as soon as we can, but we need both testing ability and a public health infrastructure to be able to do that safely.
I know testing is starting to open up. For example, Wilmington Health will likely open up COVID testing for the community very shortly, within the next handful of days. What are some of the caveats related to the testing, related to false positives and false negatives and things like that?
Right. So there are two types of tests broadly, which are available. The first is the molecular test, the PCR, which looks for the virus in the nasopharynx. The problem with that test, it's quite good once you develop symptoms. But of course, we know that people can be contagious even during the pre-symptomatic phase. And there are some people who never seem to develop symptoms at all. The problem with this virus is that it is quite transmissible, meaning that for every person who becomes contagious, if they do not engage in social distancing, they're likely to infect 2.5 other people. So if those other people then become infected and contagious and don't socially distance, then you can see how the number of cases can snowball quickly. The test that we use, the PCR, is not very sensitive until just before the patient develops symptoms. So there may be a several-day period there where the patient is asymptomatic and the test will not pick up the fact that they are infected. So that is a concern, and that's also why we would emphasize that social distancing really has to continue. The second class of test is the serology test. This is a blood test which looks to see if you have evidence for having mounted an immune response to the virus. This looks for antibodies in the blood. And those tests will help us determine what proportion of the population has already been infected. And it looks like if you have already been infected, that you are likely to be immune to reinfection, at least for a certain period of time. Now, the tests that are out right now, many of them suffer from the lack of specificity, meaning that the antibodies that are detected may cross-react with other COVID viruses, other coronaviruses that are not this coronavirus, but other ones that can commonly cause the common cold, which circulate also in the United States. We would anticipate, though, that in short order, we will have tests that are much more specific for just the virus that causes COVID-19. And once that test becomes widely available, then we would want to use it broadly to see who may already be immune and what proportion of the population has already been infected.
Great, that's really good information. If in our parting comments today, what advice would you give to the community?
Well, I think it's important to understand. For example, today, Wrightsville Beach is open. The local government will be opening up other venues, but just to remember that going to the beach is fine so long as you maintain social distancing. So going on long walks with a mask on the beach, separated at least 6 feet from others, that's fine. But therein lies the rub. We can't be having, Palm Tree Island parties where people congregate and bunch together. That would be a recipe for potential disaster. So as we open things up, we must continue to socially distance.
Dr. Kamitsuka, thank you. Really appreciate your time today. For those of you who have questions, you can look at the Wilmington Health website at wilmingtonhealth.com/COVID-FAQ. I'm Jeff James, CEO, Wilmington Health, with Dr. Paul Kamitsuka. Thank you so much.
Thank you.